America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, John. All right, so business item 5A, we're going back to the approval of RSU 13 school reopening and operation plan.
Lauren, if I can interrupt.
Yes, go ahead.
There are three people watching on the YouTube stream, and I cannot post anything to it to tell them to switch to the Zoom meeting. So whoever has access to the YouTube.
So YouTube is now streaming live.
Oh, good. Okay. So
Is there audio? So whoever has access to the YouTube.
Yes.
all right, we're all set. We're rolling. So we're back to our stay safe, stay open plan. And I just want to say to all the people who wrote emails to us, I have read every single one, every single word, and we all value every word that you have sent to us and expressed to us. We thank you so much for that. I do want to say that one of the moms, I think it was a mom, maybe a grandma, anyway, talking about like a second grader, and he's so excited about school, this backpack is already packed. So it's already packed. So it just made me laugh because he's all set to go. She's like, make sure you open. So anyway, that really made me laugh. Tonight, just before Dr. Litke speaks to us, there's one thing we're going to do. I'm going to recognize Carol Backoffner to read a brief statement.
Yes, thank you, Lauren. Fellow board members, staff, administrators, and families. I know that my comments on Tuesday night caused some frustration. I believe there is a misunderstanding about my possibly wanting to throw out the planning and hard work done on behalf of our school community. At no time did I suggest that we start over or any such thing. I'd like to be clear as to what are my concerns, and Lauren has invited me to do so before we pick up our very important discussion followed by our vote. Here are my concerns, not necessarily in order of importance. Number one, I am concerned about the prolonged exposure time of our teachers as they will be in the presence of many students over a period of time when the CDC and other agencies have said that safe exposure should be 30 minutes, not 30 minutes, 5 minutes of no exposure and another 30 and so on and so on. I want our teachers to stay healthy because we value them and we need healthy teachers in our schools. Number two, I am looking at what summer has been with teens gathering in groups, families going out to group areas, restaurants, etc., plus tourists here with, in many cases, no masks or social distancing. This was the reason I suggested delaying in person briefly until we see what summer has wrought. We heard today about nearly 24 new cases in Maine, with 2 of them being high school football players who have been attending sports prep in Foxcroft. This is worrying to me. Number 3, I am a proponent of science, as we all declare we are, demonstrated by our focus on STEM in our schools. Science experiments generally begin with baseline data to determine the efficacy of the experiment. We are embarking on a science experiment, with the unknown being possible infection by COVID. Since we will not be testing everyone or anyone, not our fault, we are not able to do it, since we will not be testing anyone or everyone who initially enters our buildings, we are missing the baseline data part. Taking temps and doing self-assessments don't provide baseline data needed to measure the safety of entering our buildings. So I am concerned that rather than utilizing science, we are instead going with a fingers crossed method. Having expressed these concerns, I do think we have an excellent plan that is a reasonable starting place for reopening schools shortly. I will vote yes, despite my concerns. I deeply appreciate all the hard work done over the summer and am grateful that we all care so much for our students and their families. I do hope and pray that I am wrong about what I believe will be our next set of issues. Thanks everyone for listening.
All right. Thank you, Carol. I wanted her to say that, to sort of take that off the table. It caused a lot of concern, the possibility of delaying. So thank you for that. So Mr. Pico, Tom Pico, please introduce our wonderful guest. And we will have a half hour. We're going to go to 7:20 on this, all right?
Great. Well, thank you, Lauren. Yesterday morning after our meeting, I received a call from Dr. Mark Foray, who's the president of Penn Bay Medical Center, who had read about our meeting and had been speaking with Dr. Lipke, who we're going to hear from in a couple of minutes, but just offering support from Penn Bay Medical Center to help school systems locally with our deliberations, and expressing that Dr. Lichty would be very interested in joining us and speaking with us, not really about our plans specifically, but just about the current status of COVID in our area. And so obviously, I reached out to Lauren and John, and we all agreed that we're very grateful to Dr. Lichty and Penn Bay Medical Center for their willingness to support us in this process. And so I'm pleased to turn over the floor to Dr. Cheryl Lichty, who is an infectious disease specialist at Penn Bay Medical Center. So thank you for being with us tonight, and we look forward to hearing what you have to share and to having the board have an opportunity to ask you some questions too.
Great. Thank you so much for having me, first of all. I think thank you should be the theme of all these discussions, by the way, for the foreseeable future. I just want to say, I'm coming at this as an infectious disease doctor who has been involved in the leadership of the COVID response for my hospital, but also for Maine Health, where we have over 20,000 employees. And for example, among the things that I've been very heavily involved in is sort of the leadership and consultation around all of the employee health issues, which have a lot of common ground with what you're actually going to be dealing with. But I'm also coming at this as a parent of 2 school-age children in a neighboring district. So I've been thinking about this from a number of angles. And I really appreciate the opportunity to hear Carol Backoffner's concerns up front. I made some notes so that hopefully my comments can address some of those concerns. And just kind of briefly, in case I miss anything, in terms of concerns about prolonged exposures, which I think we should be concerned about for both teachers and students and really anybody in the building, again, the goal of these plans is to prevent exposures, period. So I have a ton of experience with that, by the way, in this very large health system that I work for over the past 6 months. And we've done extremely well. And I can talk a little bit more about that later in terms of preventing exposures. And I mean preventing exposures with just the simple universal masking protocol, not all the other stuff we use in different situations that are not encountered in schools. I can also touch on the concerns about the summer, because I think that's a really good point, but we have data to counter those concerns, and we have live kind of real-time data. And finally, yes, in some ways, this is a grand experiment, but in a lot of other ways, it is not, because there's actually a long history of globally in epidemiology looking at the role of school closures or openings in the setting of other respiratory diseases. And now with COVID, there is a substantial experience in terms of the real world transmission dynamics is sort of the term we use in epidemiology, how this happens. And that's really important because, for example, you'll be seeing, or you have seen, I think, a lot of, unfortunately, a mix of responsible and irresponsible science coverage in the general media, including a lot of examples of people getting together and demonstrating that aerosolized particles travel long distances and can be, detected through various laboratory methods. And some of that data has been used to really generate a lot of concern over transmissibility. But at the same time, there's now actually tremendous experience with outbreak investigations looking at what really, really happens. This is not nearly as easy to spread as, for example, measles and a number of other infections that we are very familiar with. So let me just go back to what I sort of planned to start with, which was just to give you a little bit more background in terms of the epidemiology of what's happening here in the Mid-Coast. I am confident that everybody on this call and probably everybody calling in has really been keeping up with this in terms of the data that the state has been sharing, and that's really valuable. I just want to emphasize some key points. A lot of the data that you see from the state is data that's actually for example, collected through my hospitals. And I'm very familiar with the cases that we've seen versus the number of people that we've tested. Maine has been a leader in testing nationally, and we are broadly recognized as having some of the best access to testing. That has enabled us to have more confidence of what is or isn't going on in our community. We draw from both the testing of people who have symptoms and are coming through our testing sites, but also a large number of people without symptoms that we are testing. So we now test everybody who's being admitted to our hospitals. That's Penn Bay and Waldo. Actually, all of the Maine hospitals, I should say, which is 9 hospitals in the state. We are also across the system testing everybody who's undergoing procedures. And the reason we're doing this is because we want to make sure that we identify people who might be at risk for complications, for bad outcomes, for procedures that maybe should be rescheduled if it turns out that they're about to become symptomatic for COVID, for example. But that information is also giving us this tremendous amount of real-time knowledge about what is or isn't happening in our community. So to be a little bit more specific, across Maine Health, this means about 5,000 people a month are being tested asymptomatically. And at Penn Bay alone, that's about 500 people a month. That's a lot. And I'm just talking about people with, again, no symptoms. It's a great surveillance method. And across the entire system, about 0.04% of those people are resulting positive. This is using the standard for testing. And at Penn Bay, so far, we haven't had any positives in that asymptomatic group. And as you know from the publicly reported Maine state data, we've had very few COVID cases. Now, the cases that are reported to you, by the way, are only in people who are full-time residents of Knox County. So you may say, what about from away? Well, I know about a lot of those people too. And because we take care of them, or they call us if they've arrived in the state and only find out after arrival that their pre-travel test is positive. And I can tell you that I'm not aware of a single case of transmission to another person that resulted from a scenario like that, specifically in terms of the people who don't get their pre-travel results before they come here. So that's all to say that, and very importantly, speaking to Carol's comment, we are now more than 1 month into a tremendous increase in visitors from out of state. And so, which is at least 2 incubation periods, if not more realistically, because most people will develop symptoms if they're going to far sooner than 14 days. So it's interesting, even though I share the concern about seeing some people in town unmasked, et cetera. For the most part, I think people have been doing the right thing. First of all, we've been doing the right thing as a community for months, and it's been working. And I think also visitors actually, for the most part, have been doing the right thing. We are not seeing fallout yet. And I don't expect it to change over the next several weeks. That said, we don't have a crystal ball, and we get that. So that's the epidemiologic situation. And that's the reason why I think we are just so uniquely privileged in Maine, and especially in this community, to be having this conversation particularly about offering options for in-person school. So that's the starting point. So, I think it's pretty clear when you just stop and think about it, but I can't stress enough that schools are not going to be the source of the problem here. If a problem arises with an outbreak, it's the community that's going to be the source of the problem. And if we start seeing transmission in the community, yes, it'll be very hard to keep it out of the schools. And the source of spread in the schools, by the way, could be students, but could just as easily be teachers or other staff. We all have to see our role in that possibility. With respect to children and transmission, by the way, we still have a lot to learn about kids, but we do know that the younger you are, the less likely you are to get very sick. It may be that you're still almost equally, if not equally likely to become infected, but it still looks like very young children in particular are less able to transmit the infection. And we're learning more about that nonetheless. But in any case, given the epidemiology that we see, which could not be better right now in this strange world, I really feel strongly that the starting point should be, responsibility as a community member. It's very important for all members, everybody, to be able to ask all the hard questions of the district in terms of what the plan is to keep students, staff, the community, everybody safe. But I feel so strongly that actually the first question, the most important question, is for every community member to ask themselves what they're going to do to keep the community safe. Because we're in this good position that we need to perpetuate. And I know, I think some of you may have seen on Village Soup, I wrote an opinion piece about this, which I frankly was inspired to write after the local school district meeting in my community or district last week. I was very impressed by all the questions that are coming up, but I really think we need to start with ourselves and know how to do this. And I've sort of, outlined in that piece what we need to do. And the schools, you guys are creating a plan that involves the same principles, the same multi-layered approach that is based on, and from my perspective, by the way, the most important points are, in our community, avoidance of non-essential travel to places with higher transmission rates. And our transmission rate, again, we're starting at 0, basically. And that includes thinking about who you want coming to your home or your workplace, by the way. So the travel thing's really big. I think the next thing is universal masking is so much more valuable than most people in my field ever thought it was going to be. Of course, social distancing is important. It's I don't want to trivialize that or any of the other measures. But I think those things I mentioned first are the most important. And then of all the various things that you guys are planning, the key issues are really being attentive to people who are higher risk for complications of illness. And that's why giving parents and families the option in terms of remote versus in-person learning wherever possible is important, because despite everything that you do, there may be some people who kind of do the calculus and have a very high risk, either student, staff member, family member at home, and think, what, this isn't right for me. But right now we're in a great position for everybody. So, and again, it's the community individual responsibility that is just huge. And also the community, the parents, the family members, the adults in households with children to model behavior for their children. Because I am not a teacher, but I am a parent. And I think the kids can do it. And I have 2 kids who have been participating in day camp this summer where they had to mask, for example. And they've been doing a great job. So, and again, don't let yourselves get bogged down in any one element of your plan. Remember that it's all of the elements of your plan that come together. So the making sure everybody listens to the governor's orders about quarantine, the daily symptom screening stuff, it's really important. The, starting with just not sending a sick kid to school, asking hygiene, the environmental cleaning stuff and the HVAC stuff, by the way, yes, it's important. It is not at the top of the list. I really want to stress that it's not at the top of the list. Speaking from our own experience, again, not only has the organization that I work for been delivering a lot of direct COVID care in Southern Maine in particular, but we have been, ruling out testing, evaluating people with possible infection for months now. And particularly at Maine Med and Southern Maine Medical Center, which are the main health hospitals in areas that have really dealt with a significant burden of COVID disease in March and April. We had staff members who were involved in care of patients we thought didn't have COVID, and then it turned out they did have COVID. And I'm one of the physicians involved in handling a lot of those exposures, and I continue to do that. And we have been very aggressive about how we handle those exposures, but I got to tell you, it has gone so overwhelmingly well. We have so rarely seen something happen. And I am specifically talking, I'm referring to examples of people where we had staff interacting with a patient with wearing just a mask, not a special mask, okay? No N95, none of that other stuff. Like there's no relevance of those stories for this conversation. But we had people involved in direct patient care where there were exposures, and overwhelmingly they did great, and we did not see transmission. That's how well the universal masking has worked for us. It has vastly exceeded expectations. And we can't socially distance, by the way, in my world. So first of all, our buildings, like, they just don't allow it. Like, I work in a rabbit warren, essentially, in my office. And we do everything we can now to implement physical distancing in the way we work. We try to implement physical distancing in terms of rounding and all these other things. But at the end of the day, it's really hard. I have somebody who works like 8 inches away from me. Also, I touch patients all day when I'm in clinic. I've been doing this, for a long time, including through the period where other parts of Maine were actually seeing more cases. And my colleagues up in Belfast were, dealing with concerns about the fallout, for example, from the Tall Pines nursing home outbreak, and were actually involved in direct care of some of those patients. We did great. So I want you to know that. I don't want you to assume that the reason we did so was because we were always in a spacesuit, because it doesn't work that way. When you work in an emergency room, or a lot of other settings, you don't always know right at the get-go. So we've been down that road. So that's and then, one other thing just to mention, before I'm happy to answer questions. A lot of questions I've gotten in other settings are, well, what if, what if there's a case seen in the school? In what circumstances is the school going to close? Like, how do we plan for that? Or not close, but go to remote learning? I think, first of all, this is why the color-coded system was set up by the state. And the state is monitoring this epidemiology in real time as well. And if the situation changes, that's your major guideline from state leaders now in terms of switching to remote learning on an individual basis. If you have a case in a school, CDC is going to be all over that. And I think that they have learned and been very informed on how they're going to approach that through their previous experience with the long-term care facilities, the nursing facilities. There is a kind of a natural progression experience to how you would deal with a school, by the way. I personally would hope that if there was an isolated case in a school, that would not result in a school converting to, automatically converting to remote school. It'd be more nuanced than that. And in particular, I think that if you see a case, it will be very important not to assume that the house is burning down. Because we assumed early on with the nursing home, by the way, we saw a case, the house was burning down. And in several situations, it wasn't. And that scenario is a much higher risk scenario than the school plans that you're talking about, by the way. So I apologize if I have rambled, but I do hope that this is helpful, and I'm happy to answer questions. And, at the end of the day, we want to be there for you in the educational world as much as we can.
Thank you very much. That was just wonderful. And we'll have questions. I see you, Mark, but I just want to start off with, what are the plans you think we should have if we start planning now for the flu/COVID season coming up, like for schools to be monitoring that when that occurs, when the flu breaks out too?
Yeah, I mean, it's a great question. So we're talking about that a lot at work. And I will say one thing that is kind of interesting is that in parts of the world for which now is flu season, so for example, in Australia, they're seeing very little flu. And they don't know whether it's just that they're going to get a late flu season, or that they're seeing very little flu because, we're all doing this stuff to prevent respiratory viruses from spreading. Yeah. So, but I do think that, hospitals, for example, we have fears that they combine flu season with a COVID rise. So we are feeling like, everybody needs to get them. And the symptom screening that you guys do for the purpose of COVID identification is basically covers all the bases with flu as well. Essentially the same set of symptoms. And then it's for us in the healthcare field to identify who's got flu and who's got COVID. And we have the means to do that. Does that help?
Great. Yep. Thank you. Thank you. Mark, go ahead.
Yeah.
Dr. Lippy, thank you. By the way, your comments were very helpful and informative. My question for you is, I think a few minutes ago you said if we were to get a case and rather than assuming the house is burning down, we take a more nuanced approach. What would be your recommendations when you say nuanced approach?
Yeah, so it won't be up to me and it won't be up to you guys ultimately, probably. So in this case, CDC will step in and advise, what the next steps are. I couldn't help but sort of pontificate on that a little bit, but it would be led by public health authorities, and CDC knows that that's the thing that they have to be prepared for.
Thank you.
Chelsea, then Lane. No? Okay. All right. Lane.
Hi. Yeah, thank you for being here, first off. And I have two questions. The first just being, if you could talk a little bit, you talked about universal masking and the benefits of even a simple cloth mask. Can you briefly talk about the difference in efficacy between masks and face shields? I think the CDC main DOE guidance allows for students with documented medical or behavioral health issues to have a face shield instead of a mask, but they have to be in a room without other students. But I think there's also allowance for staff to wear face shields. And as I'm kind of unsure exactly on that guidance, but I just was curious what data we have about face shields.
So that is a great question. And it's one of the harder things. So basically, first of all, there are various different kinds of face shields. But second, we don't have as much data about face shields as we do about masks. There's a lot more confidence about masks. And so, for example, in my world where I work, there is no option for a face shield, period. This has been really challenging, for example, in our speech pathology department, where the people who, do that work, as well as the patients they see, need to see each other talk. So we did, and we've been trying to source transparent masks, by the way, and it's really hard, although we're getting some. So we sort of said, okay, in these specific situations, yes, you can go the face shield route, but you need to emphasize the physical distancing and take other measures. Well, primarily emphasize the physical distancing, I should say. I understand the DOE's approach here. And I should say that also we have patients who, they're not able to wear a mask if we're doing certain types of exams, and so we've dealt with these challenges. We just don't give our staff any option to use face shields alone because we feel so strongly about the masking thing. But it may turn out over, I think in your scenario, there are situations where you need to allow for that. And I think that face shields are quite good. And I'm particularly interested, by the way, in the face shields that start from here up and looking for more data to accumulate on those, because we may arrive at a point where we're actually okay with that. But right now we just don't have enough information. And so that's why the policy is sort of saying, look, if you really need to, that's an option. And I think in education, you do have situations where you really need to, and it's probably very good, by the way. But we just don't have enough information. Again, don't put all your eggs in one basket. Remember that it's not, even though I'm tempted to say it's all about the masks, it's actually not all about the masks, because you're doing all these other things as well.
Lane, go ahead. Another question, Lane?
Yeah, thank you. This other one, back a while ago, there was, I think, some, I don't want to say inflammatory headlines, but there were a lot of news coverage of this inflammatory syndrome. That's why the word popped into my head, but the multi-system inflammatory syndrome that some kids are experiencing, that's correlated perhaps with the COVID. And I think that then the news dropped off, and now there's more cases again. And I'm not trying to be fear mongering, but I do want maybe some information so that families and parents have this information about this syndrome, and put it in a scientific context of how rare it is, or how often it leads to serious hospitalization, et cetera.
So I can't give you the absolute numbers on the inflammatory syndrome. There's still a whole lot we don't know about that. And we don't even confidently, I think, know exactly which cases to consider confirmed cases of something that we don't clearly understand. I think we do know that, we've had, I think, somewhere north of 160,000 COVID deaths in this country, and about 90 individuals under the age of 18. So 160,000 versus 90. And the majority, by the way, of those people under 18 who have died are between the ages of 10 and 18. In kids, the severity of illness, or how should I say this? When you compare COVID with influenza, COVID is a much bigger deal for a number of reasons. But in terms of severity of illness, the pattern is reversed. So we think of kids under 5 as being high risk, relatively speaking, for severe complications of influenza. Whereas with COVID, the younger you are, the better off you are. It is remarkable. And I just want to say one other thing, which I'm pretty sure I'm right about, is that if you look at the severe illness in let's say the 10 to 18-year-olds, where most of the severe illness has been, I think obesity, just like adult obesity, is coming out to be one of the biggest, most serious risk factors. So the bottom line is that severe illness in children is exceedingly rare. And our bigger concerns, my bigger concerns as a parent, I should say, are really about the risks for the adults with risk factors for severe illness and the older people in our community than for the kids.
Thank
Yes,
you.
Kelsey, go ahead then, Gerald.
So I have 3 questions. So one of the things that we've been hearing about how to personally stay safe, we've been hearing masks, we've been hearing social distancing, and also limiting the number of people we have contact with. So I'm wondering what the increased risk is in a school setting where we have maybe a couple of hundred people attending at the same time and they're circulating amongst each other.
So you are not, when you open the school with this plan, you are not having a gathering of 200 people. And I think that's a really good point to make. This has come up before. You're not. So you are intentionally dispersing those people across many different rooms. You are socially distancing them. So you're actually not controverting any of the guidance about large gatherings because of the way you're mapping out the flow of individuals and social distancing and all of those things. So that's one thing. I think I maybe lost another part of the question.
I guess what I'm also worried about is it seems like you're adding to the number of interactions someone would have if they were sick. And so I'm wondering if that.
Yeah. So that is, so that's why the DOE guidelines really emphasize the role of cohorting. So that is based on kind of the discussions I've had with other school people so far. And as a parent, cohorting, in other words, maintaining stable groups of children is easier in the younger grades. It becomes more difficult as kids get older. And of course, the kids who are older are the ones that we're more concerned about as being sources of transmission. But again, part of what I get back to is like how our discussion in this community is actually uniquely better. It comes from a better starting point than almost anywhere else because we don't have community transmission. So if we kind of don't spoil it, it's much easier for us to be a little bit more liberal about the cohorting and feel better about what we're doing. So, that is key. And I think, what I've seen is even in the high school, I think you have this hybrid approach, and part of why you're talking about doing that is actually to build those cohorts, which makes sense.
Okay. My second question.
Yeah. Oh. Go ahead, Chelsea.
So we've also been hearing a lot about indoor dining being high risk. And so I'm wondering about what happens if we're essentially we're grouping some students together in a large cafeteria and they're taking off their masks. They're still 6 feet away, but are we increasing the risk there?
Yeah, so what you're doing is not indoor dining the way a restaurant is doing it at all, by the way. So I don't want to get too far into like kind of the politics of some of how these guidelines have come up. I will tell you that I'm a very pragmatic person. I don't get into the fear mongering aspect, and I hope that's evident, but I have not done indoor dining myself at a restaurant, just FYI. So the way the indoor dining is, you know, the main guidelines allow either 8 or 10 people at a table. So to eat together, and they are not distanced at all. That is not what you people are doing. So I do think, you know, again, consider your plan to be a living document. I think there are lots of things you're going to be tweaking down the road. And I think from what I noticed, I think one of them may be sort of adding a little bit of detail about the meal thing, and looking at how you can accommodate basically maintaining a distance of 6 feet for kids while they're eating and have their masks off. We're very familiar with this in my place of work, by the way, and one of our toughest things has been maintaining that when people go to eat in break rooms. And I think that deserves special attention for staff in schools as well. It's a very similar scenario.
Thank you. My final question, and I'll also just take this opportunity to say thank you very much. It's really helpful to be able to ask these questions. My final question is just, I've seen some kids in just the bandana or the neck gaiter, and I'm wondering if we need to have more stringent guidelines about what happens.
Yeah, so I have feelings about that, and I don't know. You know, some of this is like it's public school. I don't know what some of the legal parameters of this are, because you know the state and the federal guidelines have been very sort of like, here's what a face covering is. It has 2 layers of cotton. Don't let anybody show up with any of those vented masks, by the way. They defeat the purpose. But I will tell you what we found I wouldn't get too bogged down about the material and all the stuff, but what we found with one of the day camps I was involved in is the buffs, which a lot of the kids like to use, they fall down. So I was less concerned about what they're made of and the fabric and all that stuff, except that the fact that they kept falling down. And so we ended up at this one camp sort of at least expressing a strong preference for a mask rather than a buff. I don't know if you can really kind of like legislate that at the school. The bandanas, I think most people think they're not so great. And again, I don't know if you have the latitude as a school to say that it's not possible to use those. And I don't want anyone to have the impression that because a kid is wearing a bandana, it's the apocalypse and they don't want to educate that child. Like that shouldn't be the conclusion from this discussion at all. Again, because these may be subtle differences and you're doing so many other things. But I can tell you that my 2 children are going to be obligated to wear the masks that I'm sewing with the sewing machine that I haven't used in 10 years.
All right, thank you. I know Gerald has a question. Are there anyone else? Because we're at 7:22. I do want to move things on. Anyone else have any questions for Dr. Litke? Tom, you do so, and Doug. So again, if you guys could limit it to 1 question each, because we do need to move on. So Gerald, then Tom, then Doug.
Hi, and thank you for joining us. First, I heard Dr. Shaw say yesterday that the neck gaiters, the fabric stretches so far that it allows lots more transmission than a mask does.
There's still a lot of controversy about that. I just want to point out, but and my concern is really more about the falling down based on what I've seen. But
so you had mentioned that if we do have a positive case in any of our buildings, that the main CDC will come in. What they have like a rapid response team, for lack of a better term. And how does that work? And do we need to coordinate ahead of time? And I know you don't work for them, but
right. So that's a question to ask Maine CDC, because I'm not them. But I can tell you that, you know, one of the things is that Maine actually is in a better situation in terms of the kind of contact investigation workforce and depth than a lot of other states. If, you know, you can be guaranteed that the minute they hear about a case that involves someone who's in a school, they're going to be all over it. Yeah. You are not going to have to reach out, or you should not have to reach out. Although, you know, when I've been involved in cases, the few that I've sort of been involved in, I have also, our lab automatically reports to the state, by the way. That's how we're set up. But I also tend to proactively just give the state a call immediately and just say, I want you to know about this now so we can get the ball rolling. And they're great.
Thank you.
All right, Tom.
Thanks. I just wanted to chat briefly and get your thoughts about class transitions in the middle school and high school level. Of course, in elementary school, you're in your third grade class and you stay in your third grade class all day. But in high school, you go to math and then you come out with everyone else and go down the hall to history, and then you go down the hall to, you know, your English class. And is that, what's the, you know, what are your thoughts about that risk
Right.
level?
I mean, this is where I'm out of my depth, and those on this call who are school principals and others would, you know, be better equipped. But I can say that, for example, at the middle school in Camden Rockport, I think their plan is to run it, sort of have like a student's homeroom is their group for the day. And it's almost like the teachers are going to have are going to be like the moving vaudeville show, like, and circulate, you know, coming to their classroom while they stay, their one group staying in their classroom, and the teachers are coming to them through the course of the day. As you point out, that's a lot harder in high school. And I would look to those who are working in those settings and hopefully cross chatting about how to kind of maximize cohorting, understanding that you can't, there's no perfect here. There just isn't. And you know, all this different stuff is going to matter. I think probably you guys have this plan for the alternating days, these 2 or more cohorts in the high school in terms of who's in the building on a given day. That's great. And then it sounds like maybe some of the classes that those students take may be remote versus in person. But this is like, I'm not the educator. But yes, cohorting where it's possible is good.
Thank you.
Thank you, Doug.
Also, I want to say thank you, Dr. Lichty, for being here tonight. It's very informative. I just have 2 quick questions. One is, part of our job, besides the safety aspect, is we need to prepare ourselves for the equipment that we're going to buy for our students and our staff. And I have 2 things I'd like to ask about. One is on the little kids that you mentioned previously that don't seem to be transmitters of it. I know the state requires us to have them wear masks, but I'm concerned that like kindergarten through 2nd grade, they may not be able to keep their masks on all the time. And I was wondering if what your thoughts were about having face shields for them as well, even though they might not have some kind of medical emergency or problem or whatever, even though the state requires them to wear masks. And the second question is, do you think temperature checks before school is a good idea, whether it's flu season, COVID, or whatever else?
Yeah, so the second question is the easier one. Temperature checks are a complete waste of time. They are a complete waste of time. So we learned that very early on. So I can go into all the examples of, like, you know, how you demonstrate that they're a waste of time, but don't even talk about it again. If a kid is sick, take their temperature, right? So that, you know, you can answer that question on the screening, but telling people to proactively do it or checking it at the door doesn't help you at all. In terms of the little kids, it's funny, my husband says I'm just a pessimist all the time, yet in this particular situation, I find myself having just tremendous faith. I think the little kids can do it, actually. But I also just remember, although there's very interesting research coming out suggesting that these little kids, they may get it. They're very unlikely to become symptomatic, by the way. They may have just as many copies of the virus in their nose as I would. But they still seem less able to transmit. And so the risks around them are less. And that's why some of the plans in other states actually came out basically just saying, we're not recommending, you know, masks or shields for those youngest children. And again, the face shield data is just not there yet. So I don't know. I mean, I don't know. And remember, in some European countries, by the way, they have reopened schools without masking, but with physical distancing. And, you know, there's various ways this has been done. And with the little kids in particular, they've been varied in their approaches on that.
All right, thank you. Carol, one last quick question. Did you have one?
I wanted to ask about sports, you know, football and the contact that requires.
So, okay. So here's the 2-minute response from me. I am not, well, I'm almost 50 and I'm trying to become an athlete, but I never was. Okay. And I didn't grow up with all this stuff. I had no concept of how important it all was in school until recently, and how, and kind of the power structures around it and everything. I'm the parent of 2 soccer players, by the way. This has become, it seems, more difficult than any discussion about teaching our kids how to read and write and do math. And I have some personal issues with that. But that said, it is, I expect, I don't know what's going to happen with sports, but it's kind of out of my hands. I can tell you that my 2 sons play on like these club leagues for soccer. And I have a lot of concern about if somebody said, well, the first game in September is going to be in Falmouth. I would not, I'd really, I don't know, I shouldn't say this on this meeting because I haven't said this to my kids, but like, I don't think I'd want them to do it. So, that's my concern, is about mixing communities, about if it was school sports, if you're going to put them all on a bus. We haven't talked about buses, but that's a challenge, right? So, and the transportation issues are a challenge. And then you're sort of saying, well, we're going to take teams and send them to other parts of the state. Like, maybe if we have a bubble here in the mid-coast, it's okay. Then you have different sports with different levels of contact, and then you're going to anger the parent who is the parent of the wrestler versus the parent of the golf, team player. Like, I'm trying to stay out of it.
And I want to thank you for giving us such great information.
Yep.
Welcome.
Thank you. John, do you want to sum up in our gratitude to Dr. Littke, please?
Absolutely. I'm so grateful that you came to our meeting tonight. Your discussion and your points were excellent. And I'm grateful for the support from Penn Bay Medical Center as well. So thank you for coming tonight.
Thanks for having me. I'll let you guys continue. And again, I really do appreciate the opportunity. And is this a leap of faith in some ways? Yes, it is. But there is a lot to be informing your decision on. And I hope this was helpful in terms of sort of adding to some of the kind of the pre-existing data and experience to help you make these choices.
Yeah, not only helpful to us, but to everybody watching from the community. So thank you again. Enjoy the rest of the evening. Thank you for all your work for all of us.
I have to explain the soccer thing to my kids now.
Yeah, you do, because it already got texted or something. They already know. So, go.
I won't say anything to Robbie about it.
Yeah.
All right. Thank you. All right, John, you want to do next? Is Stephanie going to do something next? Is that what you want to do? Or
Lauren, before we do anything else, I'd like to clarify for the record, because I was experiencing technical difficulties here during the opening.
Yep.
That I could not record the motion and the second to approve the plan, and I don't have it in the minutes.
Yeah.
Motion, please,
yeah.
And with the second also?
Yeah, it didn't happen because I wasn't sure if we just restart, because we tabled. So I assume we just restart. So if we need a motion and a second and a vote to restart.
No, I think there was a motion and a second, which started the whole discussion, and whoever made those can just, it just only happened 2 days ago. You should be able to remember.
The motion for Tuesday still stands.
Yeah, that's what I was thinking.
I just need to know who made the motion and who seconded the motion.
Oh, right.
Who made the motion and who seconded it?
Yeah, Tuesday night. I don't remember. I'm sorry.
Would someone like to offer the motion again in a second so we can?
Chelsea is making the motion and Mark is seconding the motion. Thank you for your motion.
Thank you very much.
Understanding. We're good.
And the next thing that I'd like to do is Stephanie has created a brief presentation on where we've come from, where we are now, and where we're headed. So just to sort of ground us in the elements of the plan again. So I'd like to give Stephanie the floor and let her share her screen and go from there, and then we'll have general questions after.
Great, thank you. Go, Stephanie.
Okay, as I'm pulling my screen up here, I just want to take a quick minute, and all the parents who are watching, we thank you so much. I've had an opportunity to read a lot of those letters as well, and we certainly thank you for sharing all of your thoughts and your concerns, as well as your support. And I think it was wonderful to have Cheryl Littke as as part of the presentation tonight as well. I think it was very informative. We're trying to make plans as educators, but we're not doctors with a medical background, and yet we're steeped in all of these decisions that really are based on what the medical field provides to us, but we're trying to wade through it. So it's certainly been a challenge, but that was very helpful to have her explain that to us. Can you guys see my screen if I go into this presentation mode?
Yeah, it says loading.
Okay.
But it looks like it's fine. Yeah, we're good.
Okay. So as the board knows, I like to do the where have we been, where are we now, and where are we going. I thought it would be really helpful, as John said, to ground us and bring us back to the conversation so that you guys can go into a discussion right after this. And this will be brief. The where have we been? I've got to move my screen here. So starting in early May, we established a process for developing a plan with a goal of having our plan completed by early August. Knowing we would be faced with many decisions, the admin team discussed and put to use a decision-making protocol. From the beginning, based on initial survey data from educators and families, we agreed on a goal of a full in-person opening while continuously monitoring all official guidance documents. This goal was shared with the board and our community in late June and early July. Although our plan that we're presenting is not a full in-person opening for all of our schools, that was the goal to which we were working and making a very concentrated effort. Families and employees were surveyed again in July. Teachers, directors, go back here. Teachers, directors, administrators, and our SEA have been deeply involved in the development of our plan, and our teams and committees have been tracking and adjusting plans in order to include all required and many of the additional recommended Maine Department of Education and Maine CDC guidelines. Which brings us to where are we now? We've been working on ensuring the preparation of our facilities. All of our maintenance and our cleaning crew have been cleaning and disinfecting buildings, installing hand sanitizing stations, making sure that our ventilation and HVAC systems are as up to date as possible and have the best filter possible, installing plexiglass in high interface areas such as offices, moving furniture out of classrooms in order to make more room, and moving furniture around in classrooms in order to adhere to the spacing guidelines, and preparing classrooms. We've secured our allotted PPE from the Maine Department of Education and are awaiting delivery. We have heard that we have 3 pallets that will be delivered tomorrow. We've discussed a distribution plan for the PPE. We've been working on additional purchases needed around facilities, technology, and other health requirements, such as making sure that we have plenty of materials in the classroom so that students are not required to share. We're putting together cleaning kits for classrooms. We're developing trainings around safety, technology, and curriculum. And our health protocols committee, which met all summer long, as well as our social emotional learning committee, those were 2 of our ad hoc committees. They've continued to meet and will do so throughout the rest of the school year. Which brings us to where are we going? This one looks a little scary to me at first because it's actually 2 slides. We still have a lot left to do, as you know. But we're confident that we can complete this before the start of the school year. So tomorrow, hopefully after the board vote tonight, a survey will go out to families. We'll use survey data to finalize our plans around providing meals. Our current thinking is that for a full remote opening, a family can pick up breakfast or breakfast and lunch 2 times per week at our South School location. The schedule will be determined for that. Oceanside Middle School and Oceanside High School students will be provided take-home breakfast and lunch for the day when they are home doing their remote learning. And breakfast will be sent home the previous afternoon for all of our elementary students so that we don't have to worry as much about spacing in the classroom for breakfast in the classroom. So instead it will be sent home the afternoon before. Transportation will use survey data in order to schedule bus and van transportation. We will use survey data to establish our full remote learning option and allocate resources appropriately. Special education will continue to schedule IEPs and individualized programs as appropriate. Building administrators and maintenance will continue to prepare buildings. Elementary principals will notify parents of specific drop-off and pickup protocols and any other building-specific procedures. Oceanside Middle School and Oceanside High School will use survey data to verify cohorts of students and which day students will be attending and what their schedule will look like, and notify families of those schedules. Teachers will return and begin training and preparations on August 27th with 6 days of training and preparations. Ed techs will join them on September 1st for 3 days of training and preparation so that they can collaborate with our teachers and we can ensure everybody has the correct and accurate and most up-to-date safety and health protocols trainings. Our Health Protocols Committee and SEL Committee, as I mentioned, will continue to meet throughout the rest of the school year. We'll make quick and timely adjustments as needed and as guided by the Maine Department of Education and Maine CDC. And our superintendent will review our operational status every 2 weeks following the Maine Department of Education schedule for their 3-tiered advisory system, of which we are currently in the green. And that will also continue throughout the rest of the school year. So I will stop sharing my screen in case there's any questions about that prior to the board moving into discussion.
I just have one question that relates to CDC. I was going to ask Dr. Licky and I forgot, and that is that if we do have an outbreak, she said CDC jumps in. Is that state CDC or federal or both? How does that work?
It's the state CDC, Lauren.
All right, thank you.
Did you hear my answer?
Yeah, I did. Yep, thank you. Thank you.
Okay. I'm having a really difficult time with Zoom tonight again.
All right, well, if you stay on audio only, maybe that'll help you. You certainly can do that and just jump in when you got it. Just speak up if you want to stay on audio only. All right, so that concludes your presentation, Stephanie?
Yeah. All
right, thank you very much. So now open to general questions, comments, and concerns that we have before we get to a vote. I'll just say a couple things, I'm sorry. So, Stephanie, there are things I want to ask you that I know are in the plan, but I just want you to. So, everybody has a remote option, right? All students have a remote option if they want to do it. I want to be clear that the board is going to start meeting in person in September, just like our schools, but there is a remote option if you feel like you cannot attend for whatever reason. And I want to make sure, Stephanie, that for staff, like I know of a couple of staff who they get really sick if there's a cold coming around, so is there a remote option for staff?
I think that might best be addressed by Pete, who's running the human resources side of that right now.
All right.
So the short answer is John's answer. We don't know for sure. We are working on trying to create as many virtual positions as possible. We really won't know the need until we get the survey back as to which how we can allocate resources. Stephanie's slide about allocating resources. Our resources are primarily people.
Okay.
So that will help us really determine what we can offer. We're certainly trying to figure out what pieces of certain positions can be done remotely. How do we allocate staff and students? How we pair them up.
All right.
Could a remote teacher work with a remote classroom? So we won't know that until the plans actually gets finalized and the survey goes out. We can really start to really get into the details of how we're going to operate within that plan.
All right, thank you. I have a few questions that are generally coming from the public on our comments at rsu13.org email. I'm going to summarize a few. I've got more later that I've flagged. I'll ask later after you all ask your questions, but let me just ask a few from the public. The first one is a statement, and that is a lot of people said, why are we going hybrid in middle school and high school? And y'all need to know, we wanted to. That's what we wanted to do, but we realized we didn't have enough space to keep distance between kids. That's the reason we're hybrid. Yeah, we're yellow. Yeah, the doctor said there's no community transmission. The reason is to keep space. We just didn't have enough space to put all the kids in those buildings at once. So we understand your concerns, but that's why we're doing it. On the busing, I know as a parent, I'm gonna make sure my daughter never takes the bus, not as it's a bad thing, just because it keep her body off the bus. So we're always gonna, drive her to and fro. And I encourage all parents listening, if you can transport your kids, if you can, that's great, because if you reduce the number of kids on the buses, it's going to help. Is there anything else, Pete, you want to say about generally busing in terms of how we're doing that?
No, I think as Stephanie said last Tuesday, there's both the proximity component and also the temporal component of students passing by bus drivers. So we're going to require everybody on the bus to wear masks. We're going to require everybody who gets on the bus to use hand sanitizer. We're going to have both those available. We'll have extra masks available. We are confident that that by itself, as well as this distancing of the of spacing on the seats, will be enough. But I'll tell you that we also met today. I met today with the engineer from the company that supplies our buses down in Connecticut. He came up and he had brought up a kind of a piece of equipment that would kind of sit behind the bus driver and come out to the right of the driver between him and the door and the student, that would give some extra protection, a barrier. And some of you know, but in a previous life, I was actually owner of a manufacturing company. So so I put that hat on today, and we actually redesigned his plan and came up with a plan that they may actually sell nationally, that will help create a barrier. So create that kind of confidence for everybody, both parents and drivers, without affecting the driver's ability to control the bus, both in terms of the students on board and visually seeing what's around him. So that's been the biggest concern about these barriers, is really the safety of the students, which is really the primary role of a driver. Because there's, this is a moving classroom with 22 to 25 students on it.
Right.
Now it used to be 60.
Yep. All right.
I'm taking this very seriously.
Thank you. Thank you. There's a question several times on the comments thing about MCS.
Excuse me, Lauren, can I follow up just quickly on the bus thing?
You may, go ahead.
There was a comment that we received last Tuesday from either a bus driver or family member of one, and it was about who's going to monitor the students on the bus as far as mask wearing and things like that. And I don't know if we've addressed that. I know when I was way back in the old days, in the 70s, when I was in elementary school, we had student safeties. And they were students that were picked out. I don't even know what the process was, but we got little yellow sashes, and we were on the buses. We were also acting as crossing guards. I don't know if that's even an organization anymore. It's something we want to consider, but I'll stop talking about it because I know my wife is really embarrassed now.
So the parents are obviously responsible. The bus driver is responsible for the vehicle and to make sure that these rules are being followed. I've talked to our director, and we've talked about other options, but what we're probably going to do, and we're considering, is at least in the early weeks of school, is possibly have other drivers that maybe some of our van drivers may actually ride along and be an extra adult on the buses to make sure things go smoothly and kind of identify issues that might come up. We have tentatively kind of encumbered some of the the CRF funds that we received for bus monitors. So we're certainly considering that, and I think we're just kind of waiting to see what kind of numbers we get. Again, we're talking about a much fewer number of students on the bus to control and to have the bus driver maintain the rules with. But I think we are considering, how we utilize our staff as best we can to kind of see how this works and develop plans and adjust as we go week by week.
Thank you. Carol, quick question on busing.
Yes. What happens if a student comes on the bus and says, I'm not going to wear a mask. I don't have to wear a mask. Then what happens?
So that scenario would be the hardest scenario is going to be if that student does not have a parent at the bus stop with them, and we can't, you know, deny the boarding. The other situation that we're considering is what happens if a student is clearly symptomatic, flu or something. I think that, you know, we're going to have a, you know, one of the seats will be up front to the right of the driver will be kind of a designated seat. It's the last one to be filled that student will be placed in. And really, if there's no other option, the bus will immediately call for a backup bus or van and go to the school. Because really, that's kind of the working hypothesis is that we can't, you know, take a student that's not wearing a mask or a symptomatic student anywhere else along the route. So it will cause a problem and it will cause delays. But I think we're just going to work on, you know, being as safe as possible for everybody.
All right, thank you. One other thing that came out from the questions is about MCST. And, you know, if kids go there.
Lauren, you froze.
You're frozen, Lauren.
Social distancing and of course masks. So they're going to be quite safe over there with the new big building.
We missed all of that. You were frozen.
Yeah, I'll start over. Okay, so MCST, they're going to be really safe over there because there are like 145 kids in there at one time. It's a huge building now, lots of social distancing, masks everywhere. So I understand that parents' concern, but I think they're really going to be a safe place and they're operating exceedingly well around that. My last question that came from the questions was masks and a hot day. So there was a time like 10 years ago where we actually shut down school the Friday before Labor Day because it was so hot. Anyway, so if it's a really hot day and kids are wearing masks and the teachers and everybody like, oh my God, have you thought, John, about, you know, what we might do if there's a really hot day and that kind of discomfort from masks?
So your superintendent has broad experience with this. Because I had to close schools in Belfast, probably about the same time you're talking about.
Yeah.
And at the high school upstairs, it was like 105. And I closed schools. I said, we're going to close. So, you know, I have excellent administrators who are going to communicate with us, with me. And if I need to make that decision, believe you me, I'll make it because, you know, we need to have, if people are so hot that they can't think, there's no point in having them in school.
Yeah, okay.
Because, you know, learning stops at that point. It becomes a health risk. So I have no problem at all in making that call.
All right. Thank you. Chelsea, then Mark, and then we'll keep going. Chelsea, go ahead.
So I had two questions actually for Pete, since seem to be on questions for Pete time. My first question, Pete, do you want both questions now or back and forth?
I'm getting kind of old, so maybe one at a time.
All right. So I know that we don't know numbers of how many staff will not be able or feel comfortable returning, but I just wanted to make sure that we are going to be able to use all of those teachers and that we're not going to lay people off because they don't feel comfortable returning. I'm sure you guys have thought about that.
You know, I think that we are going to do the best we can to accommodate as many people as we can. I think that's an individual choice by an employee. But we have, you know, we've got a substantial, you know, sick day policy or for staff that have a medical reason for not being there. We're going to do as best we can to accommodate everybody. I mean, so it's going to be really that, you know, there's a lot of choices that staff need to make, you know, that, you know, if we follow, you know, everything that we can, if we follow the CDC guidelines and create the safest space and safest environment that we can, you know, I think that the only reason that, you know, staff may legitimately not be able to work is a medical reason that's substantiated by a doctor.
I guess what I'm really asking is, so let's say we have somebody who has that, but we have too many people. Are we going to make sure that we can give them remote jobs or something to keep them on the payroll?
And I need to jump in here because it's really not Peter's realm, it's mine. So the stance that I'm taking is we're going to meet individually with staff who may have health issues or other concerns. We're going to offer them all the options for leave that they may have, and we're going to work with them. My stance is that if we're going to work with those individuals to try to accommodate them as best we can. I am not in the business of just putting people out of work. So I think we're going to have plenty of work for those who want it. That would be in the virtual realm. So I feel pretty good about that. I've talked with the SEA, our teachers union, about that, and they know what my stance is. I want to help people, and we work with them to the best of our ability.
Okay, thank you. And my second question is, Pete, you talked a lot about ventilation at the last meeting, but what I didn't hear was how do the upgrades, how are they relevant to the coronavirus specifically? So how effective are they in terms of the specific?
Well, I think that when you go from a crack ventilation system like we had to a true air handling system, you're building in you are deliberately sealing your building to allow the equipment to do the work. So the thought process is, they're already being delivered to us and set to reduce the ability for the equipment to cause or even transmit big particles like mold, but also smaller particles that attach to dust with the filtering system. And our system is primarily using filters that are the MERV 8, that level of filtering. That's kind of the industry standard. We have gone through our systems and kind of assessed what systems are using what filters, and we've found in mostly the 8s. We have a couple that we've been able to pull 13s and 14s out of, so we're actually using the filters that go down to like a 0.3 micron size, which will capture a lot of the particles that would bacteria and viruses attach to. The thing with the higher the MERV value, the thinner the screening is, I guess, if you kind of visualize it, and the less can get through it. You can see how the system, and thank God we have a new system, because a lot of school systems can't even use these filters because they would overwhelm the system and they would just stop. There's other districts around here that can't do that. But we are trying to see our systems and put as high a filter, a kind of the highest quality filter in these, recognizing that our energy savings will be negligible because we'll actually be using more energy because it has to suck harder to get the air through the filter system, and we'll be changing filters more often. So it's almost doubled. So you take the typical rotation is 3 times a year for a school, and we'd probably be at 6 for some. So there'll be probably another like a $15,000 a year cost just to change out the filters and do the system change, not to mention the energy usage. But that's being budgeted with these funds too. We're just we're going to maximize the amount of outside air coming into the buildings, bypass the built-in system that automates it, that says that that it's constantly measuring carbon dioxide, and as that level rises, it brings in more fresh air generally. I mean, as a rule, we've just kind of turned that system off and bringing in the maximum amount of air already, and that with the filtering system, we believe meets the both the letter and the intent of the guidelines.
All right.
Thank you. If I could add a point here, we really need to only filter the recirculated air that's within the buildings. We don't need to filter the air coming from the outside because that's cleaner. And if you can imagine, the smaller the filter that's able to capture more things, the less air moves through it. If you've put two coffee filters on when you're making coffee, the water just doesn't go through as fast. And so it's this trade-off as to how much air we can shove through the filters without burning out the motors. And so it's a delicate system.
All right, thank you. Mark.
Yeah, this question may have already been answered, but I'm going to ask it anyway. There was an email I received from a TGS parent who said that they were concerned. Apparently, there's a couple of rooms that don't have very good circulation, and she referenced the library as one. On a particularly hot day, apparently there's not very good, it can become very hot. She was concerned about her son in particular, but I'm sure that maybe other kids feel the same way, that it's kind of hard to get stuffy in there. I don't know if our new ventilation system has remedied that, but I can also think there's another room up in the high school. I don't know what the room, it used to be the old book storage room in the high school when I was there. Jennifer True had that classroom when I toured the high school last year, if that's helpful to anyone who knows what I'm talking about. But will there be any way to address that? Is our ventilation system taking care of that as well? Or do we have to have special measures for these rooms? Thank you.
I don't recall that specific room. Going back to the heat and the uncomfortableness, we live in Maine and we don't air condition our schools.
Right.
I think it's kind of part, I have a system on a computer behind my desk that I can monitor temperatures for the entire district in every single room. And I can see that the upstairs at TGS, I can see the upstairs at South School, even Ash Point, a brand new school facing north, with trees, gets incredibly hot in August. Luckily we don't usually go to school in August. Usually we're not, a lot of people aren't even working in August, but this year is different, so we're experiencing it. We've been apprised of individual concerns at TGS and specifically over the last couple of years. We have brought in experts in asbestos, in mold, in air quality, as well as our contract with Siemens and their equipment to have independent testing done in these buildings that we've never had any issue except that a clean bill of health on all of these rooms that have concerns. They're big buildings, they're old buildings, they're odd shapes, but I think as a rule, we have a really good school system in terms of ventilation.
The room in the high school I'm referencing has no windows. And again, when I took my tour of the high school last year, the teacher had fans set up in several locations just so air was moving. So I don't know if measures like that would be taken for if there are any hot spots per se. But that came quickly to mind when this parent asked me this other question.
So we are purchasing a large number of fans, mostly for to dissipate heat reasons, because fans are controversial by themselves as it relates to COVID. But for heat, we are definitely we're going to get a couple pallets, I think, of fans that will be used to disperse the heat if this continues.
Okay.
Again, to be clear, we have $1.4 million from the federal government to spend by December 30th on things related, right? So in terms of people and their tax money and their dollars, we're getting a lot of help from the government to do that kind of thing. Correct, Pete?
Yeah, that's correct. And what I'll do is I'll send the board kind of a more up-to-date where we stand on that money and what the big groups.
Yeah, good.
Purchases that we'll be making and kind of the big areas.
Yep. Okay. Thank you. I see Doug and then Gerald.
Can you hear me now?
Yeah, there you go. Yep.
Okay, thank you. Sorry. I just want to make a few comments about the last meeting and also the plan itself. First of all, I want to say thank you to all the public who sent emails in. I tried to read almost all of them this week. Today it was not an easy task, but thank you for your input. I think it's very important. I want to just tell the public, just in general, that the plan was delayed getting to the board this month by a few days, 4 or 5 days. So we didn't get it until probably the end of the first week of August. And we had about a week to review it and make our questions and any questions we wanted to ask the staff. which we did. And I think everybody asked quite a few questions of the staff. And then we had the discussion on Tuesday night. So I think it's important to know that we've been working vigorously since we as a board had this time to look at it. I had made some I would say suggestions in the form of questions that I got answers back from our staff, which I'm very appreciative of. Overall, I thought the plan was a good plan. I had some concerns about the high schools, particularly since from the discussion on Tuesday night, the kids would only be going to school maybe, I'll see a teacher maybe 6 times in a month. And I'm not totally happy with the high school plan, with them leaving school early, even if they're doing things remotely on the same day they attend school. I personally, if I had to do this over, I would probably say I would recommend that they go to school the whole day and in person and nothing remote in the afternoon, the day that they were there. The rest of the plan, I think, is very good. Bill Gifford, I think, made a good point the other night, and I think the flexibility of his plan as well as the elementary school is good. Bill mentioned the fact that because of CDC guidelines, we have to spread the kids out. And there's a big concern, I understand, with the younger kids, 11, 12-year-old kids, the 6th graders, that may be home alone for their own learning. And he mentioned the fact that he would try to bring them into school if he could. I like the fact that tonight Stephanie presented that they're going to review this plan in writing every 2 weeks. So we saw that on her slide tonight, which is important. And one thing I would like to add, which came to me immediately on page 2 of the plan, we talked about additional priorities given the COVID situation. And you can say this about everything that we're doing. I added into the plan, I said, to the best of our ability, we will, whatever it is, because that's what we're going to be doing to the best of our ability. And I think it's very important that when the public looks at this plan and they look at the whole thing, it's not complete. I would like to have it more specific. I would like to have it more detailed. But I think the idea, for what I'm understanding, is if we approve this plan tonight as is, or whatever minor modifications we want to make to it, that the staff is going to take it back. They're going to conduct the surveys. We're going to find out how many kids want to do remote learning, or how many families want to do remote learning. And remote learning is not optional. And I want to emphasize it is not optional, because in the spring when we had emergency learning, there was some material that went out to some of the students and some of the families that not everything was required. So I want to be clear about that. And I think a normal expectation would be that for people who are listening, if you choose the remote learning option, we have to figure out how we're going to do that. So it may be that your student may not start on September 8th, because the teachers may need time to get their lesson plans together, and we need to figure out who's going to be in what classroom. So I'm prepared to pass this tonight as is. I would like to see some minor changes to it, but honestly, I think the most important thing is we will have to work together to ensure that this is going to be completed as best we can. And that's sort of my comments.
All right. Thank you, Doug. Gerald.
I have 2 comments and a question. The first is I want to thank whomever is responsible for getting the translated plans out there. I appreciate that. And I want to emphasize to the public that so these are plans for our English language learning families. But to the public, if you're having any trouble understanding the plans, whether you need reading or whatever, John, should they contact your office for help with the plans, or Stephanie?
Yes, they should contact the office of the superintendent. We'll direct them from there.
Great, thank you. There was another question that came in via email about the schedule at MCST, and I don't know if Jesse is here, but it's my understanding that the students at MCST will do their regular rotation, which would be every other day, and then that they would go to the high school on their blue day or white days. So one day in school, MCST, one day out of school, MCST, and then continuing on. My question is, when we were at the MCST meeting last night, Lauren and I asked about what protocols they have there, and as far as how they're dealing with the COVID. And as Lauren explained earlier, the school is really set up where it almost by definition, it involves pods of students, because they're just so focused on one trade that they really have very little interaction with the other students there. But there was mentioned that they're going to be using an app at the start of every school day at home. And I don't know, and also Cameron Hills is using the same app where they do basically a self-test that and we would give them a green light or a red light as to whether or not they should attend. And I don't know if the RSU is using that, if we're considering it, and that's my question.
We've discussed that with our nursing staff, specifically that exact app. And based on what they've researched, they didn't recommend it.
One of our concerns, Gerald, is the efficacy of that. I think over time, I don't know if parents are doing the screening at home, that's one step. Inputting data into a phone is a second step. And that's if they have access to a phone. If they don't, and yet we're requiring it, then we're asking kids to bring in a lot of papers. And then, what happens if they don't bring in the paper? So there's sort of this whole other side that we would have to look into. And we just didn't feel like that was the best place to be putting our time and energy.
No, I understand. It's just we're a small community and people talk amongst towns, and I thought I would just bring it out there.
We thought about it because we thought if it was done right, it could have been used for contact tracing, but that's not this app doesn't do that. They're also running into issues that it doesn't work for visitors, so they're actually setting up a Google form for visitors that you enter. So it's a cumbersome system that didn't seem to match this district's needs.
All right, I'm going to jump in with one question. I've got many coming from comments at rsu13.org from parents and folks. So one question is, would the board administration feel comfortable to ride the school buses and the vans for the first week to observe what does versus what doesn't work? So that's something for us to consider. I also wonder, John and principals, is it possible, are you planning, or is it possible to do outside receptions for students on first day? I know I participated in the past at South School, and I think it'd be safe, but I would imagine if you're a kid coming to school, it'd be pretty awesome to have people cheering you as you come in. And if that's possible, all of us, if we felt right to do it, could go to our home school, like mine is obviously Cushing, to participate in that. So anyway, that's just a thought and a question to John and Stephanie and principals.
So I'll weigh in on that. I don't see any reason why that couldn't happen. Because outside you can distance.
Yeah.
Outside you can distance really pretty easily. But again, some of these things as we go forward, as soon as we get a plan approved, we're going to be developing detail after detail, plan after plan that we'll communicate out with parents. And really what we're waiting for. But okay. I fully foresee that we will have the same kind of traditional greetings that we've always said. We'll all be wearing face coverings.
Yep.
We'll all be socially distanced, but absolutely. And I'll be right there first day. Personally, I would have no issues visiting a school or riding a bus or anything else. I'd be masked. I'd wash my hands. I'd stay socially distant from others, but I have absolutely no problem in it. And for the record, I will be running regular office hours.
Okay.
So.
All right.
No.
All right, thank you. I do encourage board members to strongly consider going to your opening day in your town. Yes, Mark.
Okay, my question is kind of like what John was just talking about, or you. What if, I know we're trying to limit access to the schools for parents visiting and walking in and out and all that, kids and faculty and staff only. What if I, as a board member, wanted to I'm still kind of curious how the movement of kids going back and forth will be. I was kind of curious about that. I'd kind of like to be able to see that. Obviously observational, not interact at all with anyone, but is that possible for a board member to come in and observe the movement of students between classes and such?
Absolutely. You need to contact the building principal ahead of time.
Okay, thank you.
And then wear proper PPE and observe social distance.
Absolutely. Yep.
All right, thank you. Next question is Tom.
Thanks. I just wanted to say that I appreciate all of the work that's gone in with the staff this summer and others that have participated in this. It's a monumental task, and I intend to to vote in favor tonight. But I also just want to put out there a couple of concerns that I have that I hope we don't lose sight of. There isn't a perfect plan. There's no way to get to a perfect plan. And so we have to choose the best out of a number of less than satisfactory options. And I think that the team at RSU 13 has done a great job in presenting us with something that we should get behind and support. Having said that, a couple of things on my mind. You know, I think it's clear that I continue to be concerned with having to do the hybrid model at the middle school and high school level. I understand why, but I guess I would say that I don't want us to be satisfied that we're going to be in hybrid all year. I think that I greatly value, and I think we have seen firsthand the value of in-person education that is far superior to not being in class. And whatever we can do to make it possible while we have this window of opportunity with low COVID in Knox County, we need to try to take advantage of that to the best of our ability. So I don't want to approve this plan and then we just settle into being satisfied with being in hybrid. I would want us to continue to try to find ways to move past the hybrid model while COVID occurrence is low to get our students in the classroom more. So, you know, I know there's a number of factors to that, and you know, staffing being one, and literally space being another. But I just want to, I don't know if anybody can comment on this, Mr. Bartkey or John or whoever, but you know, do you feel confident that we have exhausted all of our options for spacing for classes? Can we put kids in the gym and space them out? Can we put them in the auditorium and space them out? Can we put them on the stage and the cafeteria? I feel very strongly about the value of in-person education, and I just want to make sure that we have pulled out all the stops to make sure that we really can't do that. So
what I will tell you, Tom, is that my goal is to do that to the extent possible, as long as we can do it safely.
Right.
And I think once
100% with you.
And I think once we get started, we're going to understand a lot more about how the school's going to operate and what we can do and what we can't do. But I think we need to get in there and get our feet wet and then move in that direction.
Right.
And I can assure you that the principals are right there with me in that same state of mind and philosophy that we really want to open up our schools. But
yeah, no, sorry, John.
Go ahead, Jesse. I'm done.
Yeah, no, I you know, absolutely agree with John. You know, we're going to be constantly taking a look at these plans. You know, this is not a destination, but this is a constant journey. I fully believe that given the information we currently have, this is the way that we have to go based on spacing and programming and all those variables that we've spoken about.
Yep.
But those are things that we're going to be constantly monitoring and taking a look at, because I think we're all in agreement. If we could have the kids in the building more and do so safely, that's what we want to do.
Yeah, and if I enter in as well, the gravity of the situation is tremendous for me. I think I spoke about that the other night. You know, I have a priority list of who we want to bring in, you know, and we would love to get sixth grade into the building as soon as we can safely and you know, with everybody's help. And we'll do what we can. I mean, I just sent I sent an email to Stephanie Lund tonight that said sixth graders, focus. We're going to get them in. We're going to do what we can, but we need to do it as a planned thing and to make sure that everybody is healthy and safe. So, but I think nobody's resting on their laurels here. You know, this is not a done deal. This is an ongoing process of review and revision as we move through the year. So
great. Yeah, I have no doubt that you're working very diligently on all of this. I just wanted to make sure that our continued goal, if it's safe and it can meet the guidelines, is to get as many students in school as often as possible. So because they're, you know, what they get from in-person education is really, really important. And I know we all agree with that. So a couple other things, if I could, Lauren, or one really, I asked a question early on after we got this plan on email about masks and our tolerance level for students. And I think staff are a little different. I'm sure there will be expectations required for staff too, but in terms of students who might think it's funny to say, haha, I'm not wearing a mask today or whatever, or take theirs off during the day. And asked about whether it be a zero tolerance policy regarding masks. I think that, well, as much as I want to get our students into school, I think, we don't want to mess this up and have to go backwards and go remote. And I think masks are a big part of that. I think we heard that very clearly from Dr. Lichty tonight, and that we have to be very diligent about making sure that we have masks throughout. And so the response I got was about following the discipline procedure that we typically use. And to me, that makes me think a restorative justice circle. And I don't think that that's an appropriate level of response for this. I feel like we need to have a zero tolerance policy around masking because it's that important. And if we screw this up, we're going to have to go backwards and go remote, and none of us want to do that. So I don't know if anybody wants to comment on that.
I will, for sure. I mean, what that really means is students and staff are subject to discipline if they break the rules, and the superintendent has the authority to administer in the absence of policy. And I plan to do that because the Department of Education says the students will wear masks if they're attending the school, so they will.
Yep.
But the other thing is, I'm going to recommend that the policy committee look at this, even if it's just as an emergency measure, and write policy regarding both staff wearing proper PPE and students wearing proper PPE.
Yep.
And I think that would be a really good thing to do, just to make it crystal clear. But in the absence of policy, I'm going to follow the guidelines, and we are not going to tolerate that. We're not.
Right.
And unfortunately, if parents say, well, my child is absolutely not going to wear a mask, then I'm going to say, well, then they're not going to be attending school in person. That's not my decision. That's the governor and the Committee of Education.
Right.
I didn't just make it up.
No, absolutely. And I appreciate your stance on that. And I also want to add that, we talked about earlier that there may be some students in particular who, for a medical reason, need a face shield versus a mask. I'm not talking about that. I'm talking about, students generally and staff in the normal course of being in our school. We don't want to do anything to jeopardize having to go backwards, because we want kids in front of their teacher. So I think that the masking is really critical. So
a medical reason is totally different.
Right.
And we'll take that case by case, but they have to have medical documentation that they would be prohibited from wearing a mask. And in such cases, we could work with them to determine if they can wear a face shield.
Okay. Thank you very much.
I want to jump in real quick because I don't want to downplay the importance of restorative practices. I helped address that question, but it's not always a punishment. Our restorative practices is discipline, which is education first, teaching the students, and then having a consequence that goes along with that. So it's not just immediate punishment, which is sometimes what we think about when we think about discipline, but the restorative practice is that educational piece as well, which is really important to our district.
Oh, and I don't want to downplay that either. I guess I just wanted to make sure that in some fashion that the issue would be addressed immediately and not dealt with at some future point. I think we can't put off addressing the issue.
All right. Thank you, Tom. And Carol.
Yeah, I'm guessing that, and this is a general question for John and Stephanie probably, and the principals. I'm guessing that the first days at school, proper mask wearing is going to be a hot topic. In other words, it has to cover both your nose and your mouth. It can't be hanging off your chin or used like the Lone Ranger mask or that. So
Yeah.
But, right, my answer is we're educators, so that's what we do best, right? So there'll be education around proper use of PPE, why we do it. I'm sure teachers will get into probably talking about different types of face coverings and effectiveness and all kinds of things, but that's absolutely going to be part of what we do.
that's what I thought.
If I can follow up on Carol's comment, there was one of the emails that we received about staggering the start of the K-5 schools. You know, K-1 on Tuesday, second grade on Wednesday, whatever. And you know, obviously we haven't seen any answers for that. I just wanted to bring it up and see what John and Stephanie have thought about that.
Well, it's an idea. I don't know that we necessarily need to do that, and we have not had that broad discussion with our administrators. I don't necessarily think it's a bad idea, but we have not included it in our opening plan at this point because we don't feel that we really need to. I would say we may have a discussion about that in future. I wouldn't say that we would be precluded from doing that with the plan adoption because, as I've stated many times, this plan is going to be a living document. So, you know, if I see something, if we see something, we seize on it and we say it's got potential to do us good and be a benefit to the students and benefit to the schools, I would probably come right back and do it because no matter what is written on this in this plan at this moment, I guarantee you things are going to change because we're going to adapt to the situation. So that's my response.
All right, thank you. Yes, Chelsea.
I wanted to follow up on the face coverings because particularly one of the reasons I asked Dr. Leahy that question, or Lipke, that question about masks is I am concerned that we are going to see a wide variety and that the frequently asked questions give a really good explanation of what kind of mask, but I wasn't sure if it didn't apply to bandanas because technically a bandana is 2 layers, you fold it right, or neck gaiters. So I was wondering if we can clarify the frequently asked question and also include that in the plan because I think more people are going to see the plan than the frequently asked questions. And I think that's a really, the effectiveness of masks is one of our central strategies. So I think it's really important that we prioritize
so
that.
At this point, there really isn't specific guidance about types of face coverings from the Department of Education and or the CDC that may be forthcoming. But I think my previous comment is probably the most applicable, and that is education, right? So we're educators. We educate the students about the best type of PPE or the more effective types of PPE to wear. I think that's part of the solution. But at this point, there is no type of mask that's recommended for us. And I have a feeling after talking with the commissioner, especially in our meeting today, that actually may end up being revisited by the DOE. If and when it is, then we'll adapt to it.
Chelsea, go ahead.
Is there a reason why we're waiting for the CDC and not making a local guideline? Because it seems like there is some pretty good evidence around this and that it's important enough. And I don't see what the downside for us having something stronger than the CDC or Department of Education recommendation is.
The question on that one is how, I would think that would be very difficult to monitor. I think education at this point is our best bet in terms of students and the PPE. All the PPE that we have certainly meets the guidelines and is more effective than just say a bandana. And I think we could offer that to students and so forth, but I don't think anybody really wants to be the quote unquote mask police and say your type of mask is not acceptable, because I think that's just going to be too difficult to deal with at this point.
Yep, Lane, go ahead.
I guess just following up on Chelsea's question is, I know that there's some mixed evidence or lack of data around bandanas and gaiters, but the ventilated masks with the open vent, there is sort of, it seems like medical consensus on that. And I think Dr. Lichty was mentioned the, vented masks as a definite, like, not effective mask anymore. Could there at least be some level of discrimination with the vented masks in particular?
Again, I think we would offer a student a more effective mask because we're going to have hundreds of thousands of them on hand, and educate the students as to why that would be more effective.
We add the word effective to masks.
All right. Next question. Yes, Gerald.
I just want to follow up on a question from Tuesday, and that in that regards our special ed students. And I just want to emphasize that it's going to be really important that we accommodate them as much as possible to what they're used to pre-COVID. And I know you guys are working on that, but I want the families out there to understand that we are trying to accommodate the students. And to follow up on what Tom has been saying, if it wasn't for the required distancing in the school buildings, I'd be just in favor of opening the schools with the proviso that everyone is required to wear a mask. Everyone wants this, all the students and all the staff in the buildings. And I know that we're enforcing the 6 foot and 3 foot distance requirements because of the state guidelines. And if we can find a way to waive those, then that would alleviate that need, and we could just have everyone in our schools, and we wouldn't be doing the 2-day on and 2-day off, or the 1 day on and 1 day off in the middle in the high schools. But I am prepared to vote yes on this plan.
Thank you. Next. I'll ask a question. Okay, I'll get right with you guys. I'll ask a question from the email. So Bill Gifford, Jessica Barkey. So let's clarify when your kids are going home on the bus or going home with their parents or whatever.
For the high school, the school day is 7:30 to 2, as it always was. We just changed the order of the blocks around.
Bill?
Our school day is 7:30 to 2 as well.
Yeah, I think people got confused. I know when I first read it, and it was like pick up lunch, like at noon or something in the high school. It's like, oh, pick up to go home. So I think there was just some confusion there. So that's why I wanted you guys to clarify that.
Yeah.
I know my 2 high school boys were hoping that.
Were they? Yeah. Sorry. Just tell them no. Go ahead, Chelsea. You had a question, and then someone else, and I'll keep going at the list here.
I have 2 related things, and they both come from a lot of emails that we've been receiving. And they're really, I know that we addressed some of them on Tuesday, but I also feel like my brain is all jumbled up with Tuesday. So I'm really just hoping you guys can sort of restate and clarify a couple of things that I think we did talk about on Tuesday. So the first is talking more about the kinds of supports that will be available for students on the hybrid days. There are a lot of concerns from parents that their children aren't going to focus and things like that. So just addressing what supports we'll be able to offer. And then the second one, actually the second one goes in a different direction. So we'll just stop there.
Are you asking either Jesse or myself to answer that question for the hybrid days?
Whoever wants to take it. I will say we've been hearing it mostly from the middle school, but also a little bit from the high school as well, some concerns there.
Yeah, no, and I understand that. I think part of that is what Peter Orn spoke about earlier tonight. That's dependent on how many teachers we have who may be looking at doing virtual teaching. So to say that I have that answer for you tonight, I don't have it. I think that's something that's going to come out in the next probably week or two. But I do know there's a huge concern among my teachers to make sure that students are connected in some way, shape, form, or manner. So we're working towards that. We're even looking at working with our tech integrator at having some sort of check-in. And the other piece of that, I think I spoke about the other night, is having our student service counselors. We have 2 at our school. We're lucky and fortunate to have that. Having one of them to be a virtual person, as well as one of them being a person, a physical person when the students are in the building. I think we're going to do the best we can to connect and make sure that those kids, when they're not in our school, are connected. But some of that hasn't really been parsed out yet because we don't know what we know. I mean, we've had several people talk to Peter Orn, and we're kind of waiting to get through that. I mean, this is all fairly recent information, so.
Yeah, I agree with Bill. We're still building out a lot of these systems, but we do know that we're working to provide scheduled time for teachers that students will know that they can check in with. So almost like virtual office hours that they can check in during those times, or teachers will be able to Zoom with students if they need help walking through those assignments. That's another reason why that targeted learning time is really valuable for the days that the students are in. If they're struggling with a variety of different factors for success for that virtual learning piece, teachers can tag those students and work with them, whether it's on executive functioning or whether or not it is on the assignments or the software or all those different factors that go into the virtual learning piece to be able to maximize that time that we have in person to make sure that they're more successful when they're working virtually. I know also our special education department is going to have a virtual person available for support for some of the special education students as well. So they'll be on call during those days as well to be able to provide a support for students who are home virtually who maybe be receiving that level of support while they're in school as well.
All right, thank you. Chelsea, do you have a second question? No. Who was next? Lane, go ahead, Lane.
Yeah, I think I'm gonna kind of continue in the spirit of some of these questions here with the high school, middle school scheduling and what that all entails, because it did seem like a recurring theme in our comments, the emails that we received, which, I really appreciated receiving all those emails. So thank you to people who sent those in. The schedule is different for the middle school because they're going in every other day. And then the high school kind of has the blue-white thing where they have the every other day blue-white schedule for classes, but they have the cohorts go in for 2 days in a row, then 2 days off. And I know for some families with siblings in middle and high school that they were having a hard time with that scheduling discrepancy. And I imagine that you had, best practices and reasons that you came up with each of the schedules that you did. And I'm wondering if you could just maybe share some of the discussion that went on, to come up with those 2 different schedules. Like what was the best practices for the middle school and what was the best practices for the high school that led you to those schedules?
Yeah, Bill and I talked a lot about families and siblings and tried to figure out ways of, balancing that. One of the challenges for the high school is we have to have a regional schedule. We have to have the every other day schedule for mid-coast students to be able to access their programming. So that is a real limiting factor for us that way. But also, as far as the cohorts and grouping them together, without making the schedule get really complicated to try to mirror in every other day at the high school. This was the most straightforward way that we can also maintain the regional programming as well, just happens to look different than what is the most straightforward way for the middle school.
Yeah, and so we, I think we originally wanted to create some synchronicity between the middle school and the high school schedule, but as Jesse spoke to, that didn't really pan out in our thinking. And, so we were looking at having 2 cohorts, a blue cohort and a white cohort, and having them meet every other day. And it, so to the best that we can, we'll do what we can, but certainly creating cohorts with siblings within our building is something that we're going to attempt to do. but it just didn't work out with the high school schedule and our schedule. So I don't know if that satisfies your question or not, but.
Yeah, thank you.
Thank you.
You're welcome.
Question for the public again is the plan to disinfect the schools, in particular the restrooms.
That's a good question.
Yeah.
I think disinfecting the schools is an important thing, and I appreciate Steve Sylvester being on board because I think he has a really good plan. And we're going to be meeting with him at the middle school, talking about what we can do to help support his custodians to make sure that our buildings are as clean as they can be. I kind of have a plan in mind, and we're going to meet on Monday and talk a little bit of that through. So that's from the middle school perspective.
I think the science too was in the beginning was about disinfecting surfaces a lot, but lately more about aerosol and things in the air and masks, right? I mean, isn't that a shift in the sort of the thinking since April? You know, disinfecting surfaces, but the real big deal is what's in the air and preventing things from being in the air, right?
I would defer that to Peter Orn.
Well, it's not just the disinfecting, it's the constant cleaning too. So the cleaning and the disinfecting really doesn't help if you're not cleaning. And we are going to be, most likely changing schedules, moving more staff in the buildings during the day to make sure that we can cover as much space as we can, and especially in high touch areas, utilizing other staff in other positions that might have a split shift, so we can, again, get more bodies in the building cleaning, and kind of just really focus on those high touch areas. Again, it's one of those things that will develop, but we have the equipment, we have the people, we have the safe products to use. So I think that we've been on top of that for quite a while.
Yeah, there are many questions about products and smells and safety of products and stuff like that. Another question from the public is, should all staff be tested before the beginning of school? John?
I couldn't hear that question, Lauren. I don't know what the question was.
Yeah, another question from the public is, should all staff be tested before the beginning of school?
So I think that's a better question for the doctor, but the testing is only a test at a given point in time. So it's only valid for that time. It's there's a 3 or 4 day window that somebody could be exposed and still test negative. So I think until there is the ability to do frequent fast testing, it's likely not going to be an option for us.
All right. Another question from the public is, are children allowed to bring lunch from home?
That's actually encouraged.
Is there an encouragement of containers or anything on that?
Containers, containers that can go home. Containers, the really most important part is that the child is able to open and close the container by themselves.
Interesting. Yeah. Okay.
That's also highlighted on the survey. So when the survey goes out and parents see that question, it does say a reminder to make sure that you will be sending in things that they can open by themselves.
Yeah, it's a fantastic detail, right? It's amazing, but a good point. Really an amazing detail. Another question here is, are backpacks being allowed? Yes, they are. Yep. So, okay. Other questions from board members? Yes, Chelsea.
So, this is actually a comment, and there's some questions involved in the comment. I think this is a really solid plan. I do still have some concerns about, maybe anxiety is a better term for it, but about the large cohorts at the middle school and the high school. But I'm going to set those aside. So I'm planning to vote yes on the plan. But there's one piece of it that I really feel very strongly that I'd like to see an adjustment made. And I don't think it's an adjustment. I think that it's something we've been talking a lot about, and I think it's an adjustment more in language than in approach. So in every meeting, I've really talked about the importance of making sure we have a robust remote learning program for people who don't feel comfortable sending their kids back to school may not they may have health concerns that make it impossible. And I know that that's a goal that we have. And I know that there are some concerns about creating a specific plan without the sort of data to back up how we're going to manage that. But I also think that it's very difficult for parents to see a plan that really only has a sentence in it about the remote learning. And I'd really like to see just 1 or 2 paragraphs that say what we've said in meetings, that we have a commitment to offering a strong and robust plan. And that also takes, I looked at the frequently asked questions and noticed there's a new section on remote learning that could even just take some of that language into the plan. And the reason that I think very strongly this needs to be in the plan and not just in the frequently asked questions is that this is what our parents are using to make the decision about whether to return home. And I want to make sure that no parent feels, if they're on the edge, that they feel sort of pressured in one way or the other. But there's also a financial interest that we have in making sure that parents who don't feel comfortable don't say, oh, well, there's not really any great option for me, and shift to homeschooling, particularly because our state funding is based on our student count. So I think as a board, we really need to focus on making sure that we are not potentially losing people because it affects our state funding for 2 years, and it also affects our local funding stream and how we divvy that up for 3. So I don't think that this is like a shift in plan. I think it's just a shift in emphasis. And I wanted to see, Stephanie, if we could add that to the plan.
So Chelsea, I'm happy to add it to the plan. But I do want to address a couple of those concerns because I agree with you. I'm sure the public completely agrees with you as well with the question of how am I supposed to choose remote if I don't really know what that option looks like. So I can certainly appreciate and understand that. And if the board agrees that we should add this language to the plan, I'm happy to. I've been hesitant to add anything in that we're not sure about. But I did put answers in the frequently asked questions, so parents will be able to see that. It was updated today. I added 3 additional questions with answers. One of them is, what is the difference between homeschool versus a remote option? So that question is addressed now. And just really in brief, homeschool is the student is no longer enrolled in our district, whereas, and the parents are providing the curriculum and they have to make that request through paperwork that they get from the Maine Department of Education website, and there's a link to that. That's all in the FAQ document. There's another question about what is this going to do for from a financial standpoint if we have a whole bunch of parents that suddenly choose to homeschool and not choose the remote option, because the remote option is where we are responsible for providing the instruction and the curriculum. And I don't have a firm answer for that yet. However, there have been conversations about the possibility of the Maine Department of Education requesting a waiver around how we report on our enrollments, and the potential that the enrollment count could go back to October of 2019. That is not confirmed, and it states in the FAQ that it's not confirmed. I'm always hesitant to write things that we don't know for sure, but I think in this case, the board probably would like to know that information, and people making that decision potentially might want to know that information as well. The third piece that was added today, and I just say this with the caveat that we do not know this for sure until we get the survey data, but I did add a detailed paragraph there about sort of the very broad vision of what we might be able to offer in terms of remote learning. So in an ideal situation, if we could dedicate 6 teachers at least, and again, this is sort of an ideal situation and nothing is guaranteed here, but if we had a K through 2 teacher, a 3 through 5 teacher, and it would likely be grade spans. I think it's important for parents to understand that if they're choosing a remote option, they're not connected to their home school that they used to go to. They wouldn't necessarily, likely would not have the teacher that they normally would have if they would have chosen the option to attend in person. They would likely have a dedicated grade span teacher of a K2, a 3-5, A 6-8, we would put 2 teachers at that level and 2 teachers at the 9-12 level. The teachers at the 9-12 level would be overseeing programming because those teachers are typically content area specialists and providing support and tutoring. That's all very broad plan, but sort of in a nutshell, if somebody asked me right now, what does it look like? That's what I would tell them. So I felt like that was important to detail for the public.
And I will say, I think that information is great in the FAQ. And the learning plan, all I'm really looking for is that really broad concept, the commitment that we've been saying in meetings we're going to do. So just having that in writing so that parents are really comfortable with it. Lauren, I know you mentioned you wanted any changes to be in the amendment. Do you want to do that formally or just take sort of a straw poll about whether the board wants to include that language?
I think it's on this one. I don't know. I'm gonna go with Stephanie's answer. I like that answer. So I know that from my point of view as a board member, I think she's answered your question. I don't see a need to amend the plan tonight with language, but I'm open to everybody's ideas, of course.
I guess what I'm saying is I feel very strongly that this needs to be in the lesson plan, in the learning plan. So I guess my question is it something, Stephanie, that you feel comfortable adding, or do you want sort of a board vote on it? Because I will make a motion. I feel strongly enough about it, but I'll make a motion. Even though we've been talking about it, I want it in writing. So the question is just logistics at this point.
So if it sounds to me like you're asking me to make the revision that doesn't say it's a goal to offer it, but instead that we will offer a remote learning plan. And if that's what you're requesting, I'm happy to make that adjustment if the board agrees.
And also that we have a little bit of language saying that it will be comparable to what we're offering in person and things like that. So the things that we've been talking about.
Yeah, I'm good with that. Amy.
Thanks for bringing that up, Chelsea. And I've been thinking a lot about this and how to bring this up. I realize everything's fluid and there's a bunch of different issues here. Like we stopped school in the middle of the spring semester and had to go to remote. Was not what anybody planned. Nobody was prepared for that. So obviously, anytime anybody finds themselves in that situation, they're not operating at the best of their capacity. And I feel like there's belief that remote learning means that we're going to go back to what happened in the spring, but remote learning can be an incredibly complex and nuanced and fulfilling and engaging way to learn. So I think that, we could actually completely flip the script on this and use this as an opportunity to learn some best practices in remote learning and to use that on a regular basis. So let's say, next year, everything's hunky-dory and we're back to a normal life. And then there's 2 weeks of snow. If we had the skills and the technology and the ability to do remote learning, then we could utilize that somehow or another. So what I would love to see is not language immediately shoved in about how we're going to do remote learning, but rather a commitment to investing in the technology, investing in the teachers, getting teachers to volunteer, to start, being trained so that they can be better prepared for life going forward in a state that tends to have certain issues with days off anyway, just because of the weather. And I think that a starting point for that is, if we could, I want to approve the plan tonight, but I would also like for us to immediately, and I mean immediately, get a commitment from parents and students who are going to stay home as remote learners so that we can start to facilitate helping them put themselves together in pods. So that, I said this on Tuesday, but it bears repeating, that if 2 or 3 kids live on a street together, then they can move around in houses on that street and learn together so that they're not isolated, and so that one parent doesn't have all of the burden. And there are tools, it came up on Tuesday, and then there was the issue about whether or not teachers would be happy to have cameras in the classroom, and remote learning is not cameras in the classroom. You know, there are fantastic tools like, you know, just very rudimentary tools like Blackboard, which you can utilize at the same time. You can have, you know, an interactive game going on with students in the classroom who are playing a game with the kids who are working remotely. And I mentioned this on Tuesday, and it's a sincere offer. I have a lot of experience with remote learning. I was part of developing a physician executive MBA program that was 1/3 face-to-face, 1/3 asynchronous learning, 1/3 synchronous learning. And there's a lot of interesting nuance, and I 100% volunteer my time to help with preparing for the future. Now that's a long game. That's not a short game. That's not something that we can immediately put in place for September of this month. But this is an opportunity to say, okay, we're going to commit to developing a long game that not only serves this semester, but puts us ahead in terms of our ability to handle any sort of environment in Maine going forward. And I talked way too long, but.
Well, Amy, if you don't mind, I would love to just chime in real quick and just follow up. I really appreciate your offer to help and support in this. It's my goal to make it work this year, and I'm going to oversee that process. And I agree with one of the sentiments that you shared. I can't remember if it was at the last meeting or if it was in your follow-up email, that what if emergency learning was sort of the bottom of the learning curve, and we can only improve from there and find some really great ways to provide that as a viable form of education. And I totally agree that we absolutely can. And I'm making a commitment to support teachers who will be instructing in a completely remote environment, just to make sure that they have the supports needed. We know that as we start this process, it's not going to be perfect, just like emergency learning wasn't perfect. We know it's going to be better than emergency learning. But I do want to recognize that everything that we're going to be doing this year, regardless of whether students are in person or learning at home, is going to be a little bit of a learning curve for us. So we certainly appreciate everybody's patience and support as we pave new pathways.
Think along those lines. Go ahead, Amy.
Follow up really quickly and say, Stephanie, you are the Energizer bunny, and you have amazing ideas and talent and energy, and we're all incredibly grateful for you always, but particularly right now, where I'm guessing you get about 15 minutes of sleep a day.
All right. Thank you. Well said about Stephanie. Thank you, Stephanie. So one quick follow-up around this, Stephanie. So the current plan on internet access for parents or kids at home, because we got devices, I think you said Tuesday, like early June or something. So if you could just fill us all in about those devices first.
Yes. So we got devices the last week of May. The state did provide a device for a hotspot for any family that needed it. And we had pulled all of our principals to find out where all of the need was. And we didn't distribute all of those. We prioritized the seniors that final week of school and made sure that we could get those out to those students. But the rest of them, it was too late. We didn't disseminate them. So if there are families that need hotspots, we do have additional hotspots. We can purchase more if need be, but the survey that will be coming out does have that question on it. So it's really important. I think the next really big push for us is getting all of our families to fill out the survey, because that's data that we need in order to make all these next big decisions.
Right. Thank you. Thank you. Gerald and Doug.
Thank you. I think all of us understand from the emails that we have received in conversations that the biggest concern of parents is that we have a repeat of what happened in the spring. And again, I have 2 kids that were in the school, and it wasn't the best situation. And what Stephanie has described as teachers who are just dedicated to the remote learning concept is sort of what I was talking about on Tuesday, where we have facilitators that do this. And what this also means is it takes that extra burden off of our staff, that they're not just teaching, that they're teaching not only their own class in person, but they don't have the extra burden of having to prepare a whole nother thing for the children at home. And so I think this is great. And I think I'm very comfortable with adding all of this after our vote tonight. Again, there's so many different changing parts. We might find that so many students are staying at home for remote learning that we have not extra teachers, but we have extra classroom space, and we can then have these teachers take over the whole learning from home thing.
All right, thank you, Doug.
So Stephanie, this is a kind of a question for you. I think if the remote, I think it's great that we're gonna have dedicated teachers for each grade level as best we can. And of course, sometimes, I think the elementary school, they kind of work as a trimester area, I think maybe 3 or 4 months, and then high school, I think maybe the semester area. I'm not sure about the middle school. One of my concerns is continuity in the education of each student. And so what if a student says, I start out remote learning and you know what, this is not working for me. I really would like to go back to school in person or whatever. Do you think it's smart to maintain the continuity for at least a quarter or a trimester or a semester, so they have the same teacher? Or is it wise to let them move back and forth?
I think that's a great question, Doug, and it is one that we talked about in our admin team. We've made an initial agreement that we would like families, and this is on the survey as well. And I think I've also updated this in the frequently asked questions, but it will be on the survey when parents are asked to make this decision. But we are asking that if parents choose the remote option, that they're choosing to be dedicated to that option for a trimester if they are in elementary school, and for a quarter if they're in middle school or high school. Now, that's not to say that if certain circumstances arise that we won't look at the needs on a case-by-case basis. But we do want to be careful about too much back and forth switching, because it's going to be a little bit of a careful balance. Not only our instructional resources of our teachers, but also our spacing in our classrooms.
Thank you.
All right, Lane, go.
Yeah, I also had a lot of thoughts about this remote learning piece and how it was written in the learning plan in terms of the goal versus commitment, and kind of what that language might emphasize or communicate to families who are making this decision. So Chelsea, thank you for bringing that up, and Stephanie, thank you for sort of your more detailed explanation of it. And I did see that in the frequently asked questions. And I think I would certainly be in favor of not that level of specificity in the plan that we vote on tonight, but the maybe tweaking language between goal and commitment. I think that communicates a lot, just that language change. Because I see it as an equity issue for our students who have either health conditions themselves or their families have health conditions that really make this a difficult choice. And also, if we have that, detail in the frequently asked questions that you provided, I think it makes it much easier for the families to commit to what we're asking them to commit to with the quarter and the trimester. So, I think those are all excellent sort of explanations that you've provided. So I sort of coming in, late on that, but I think that I appreciate this part of this discussion. And I think that moving a little bit away from the remote learning, when I initially read the plan, I had a ton of questions, and then the school board, it was evident that everyone had a ton of questions, and there was a volley in the email, and a lot of them were answered either through the email and the frequently asked questions document or through Tuesday's meeting. So I feel much more supportive and reassured about some of the details in the plan after hearing from the community and after hearing from all of you. So thank you for that. I guess I just want to make sure that it sounds like there is a lot of teacher support for getting in for in-person learning. And it sounds like the middle school and high school administrations are working as much as they can to make the hybrid plan as viable as it is, given that it is the option that is presented with the physical limitations. of the buildings. I'm still sort of a little worried about teachers trying to do both the in-person education and sort of monitoring the like remote day folks, and kind of like how that, you know, like how that dynamic might play out for teachers. And, you know, if teachers feel like they are ready to take that on, that's awesome. I think I would just want maybe continual, like some sort of update from the perspective of the teachers. And sort of, I have faith that you all are going to do that as well as you can in terms of how to manage teacher burnout and teacher time, and also provide quality education for the students. So this isn't a point where I want to tweak or add or contradict anything in the plan. I just want to point out that we're asking a lot of teachers in some areas of this plan, and maybe just, you know, putting that out there to stay conscientious of, in terms of like how we can support them. You know, how can we support them as a board, and how can, like, you know, you as administrators and et cetera support them. So I don't know that this is all leading to a question so much as a series of comments on where I've come from in the initial reading of the plan and where I am now, which I think has been, it's been really valuable to have all of your input on that. So thank you.
Lane, I'll just follow up really quickly because it's definitely one of my concerns as well, the level of professional development and support that we can provide to our teachers, especially in a hybrid model. It is a little bit of a question mark right now. I think our teachers definitely have the capacity to make it happen. I think similar to a full remote option, we're going to be on a little bit of a learning curve because we've never done this before. But I did purchase some texts. There's professional educational researchers. They actually run their own research school, and they shifted their school obviously into remote learning last year, and it's Fisher and Frey. And they have a new book out that's called The Distance Learning Playbook. And we put an order in today to purchase those books for teachers in order to support them. And I just had a regional meeting with my curriculum colleagues that work at other districts, but we've had a conversation about even offering some regional professional development or online learning modules that can support teachers in this. Not doing that those first 6 days right off the bat and expecting that they're going to just go, but trying to provide that support throughout the year.
Thank you. Thank you. I think for everybody watching and participating, we're getting pretty close to a vote here. Probably just a few more things. I just want to, probably a lot of folks, parents and kids wondering a lot about sports. So in a broad sense, can you address, you know, what we expect to happen with sports this year?
Lauren, it's a tough question because the high school sports are really governed and overseen by the Maine Principals Association. But yet we do need to follow the guidelines from the Maine Department of Education and the CDC. So in my conference call today with the commissioner, that question came up, and I know that next week there are several committees that are aligned with MPA that are trying to come out with guidance and make some decisions about sports. So I don't have an answer for you tonight. In fact, there's not an answer across the state yet on high school sports or middle school sports. So we'll have to stay tuned to that. We're going to recommend what makes sense and keep kids safe, but there can't be two different standards, one for athletes and one for students, because the athletes are the students, if that makes any sense.
Yeah, it does.
You know, we can't have one set of standards during the day for kids and then a totally different set of standards in the afternoon and evening for kids who are participating in sports. So I don't know yet. We'll just have to wait, and I hope to get some more news on that next week.
I guess I'm assuming it'll go season by season, that there might be guidance on fall sports coming out and then later on winter sports and later on spring sports.
It's a question that's right on the front burner all across the state with superintendents right now. I can tell you that.
And would affect clubs and drama competitions and everything else. So we'll just for, you know, people watching and wondering, we'll just stay tuned and we'll hear more from the organizations involved. Thank you. Unless there are any more questions, I would entertain any sort of like closing thoughts before we take a vote on this. Anybody want to finish up with closing thoughts from the board members? Yes, Tom, go ahead.
Just a big thank you to first our, our administrators, our staff that put a ton of time into this. Like I said earlier, there's no perfect solution here, but I think given the options before us, I'm very comfortable moving forward supporting this. And also, I've been on the board, I think 4 years now, and clearly this issue has brought out more public comment than in all other issues combined in my time on the board, understandably so. And I would say to the public, don't stop, right? I mean, we want to hear from you, and we're, it's interesting to watch, comments on social media and other things, and sometimes it feels like people think we live in Alaska or something. We're your neighbors, right? We're parents. We're people that are concerned about our school. It's not, we're not some, somebody that doesn't live here and have a vested interest too. We want to hear from you, and so don't hesitate to reach out to your school board members, because we're very interested in hearing the public's thoughts, and I think hopefully this is the start of more public input into our educational system. So thank you.
Nicely said, Tom. Thank you. Anybody else? Yes, Susan.
I want to just add that I think that we are so grateful for our wonderful administrators, our wonderful staff who have put so much work and energy into this when we're all dealing with something that we just don't know what's happening in the next week or the next month. But I think it's great that we've had so much public participation and that we are opening up new lines of communication. And I will comment on Tom's statement that let us keep hearing from you. We work for you. So thank you, everybody.
Well said, Susan. Thank you. Anybody else? Yes, Lane.
Yeah, I just maybe want to go back to something that Dr. Lichty was talking about, and I was thinking about is that now, once we take this vote and, obviously all the tremendous work over the summer and the continuing work to implement it, is in the school district's hands and the administrators and teachers and everyone, but it's also in all of our hands as community members to make sure that this plan succeeds by reducing community transmission. And so it's all of us, whether or not we have students in the school, because as Dr. Lichty said, it's not going to be that the outbreak starts at the school, it's going to be that the outbreak starts within the community and then gets passed into the school from students and families. And so it's for all of our sakes, we all have I think a stake in, from the comments I heard, everybody really wanted this plan to work and really wants it to succeed. And so we all now have to take that energy and be sort of extra vigilant about, how we use social distancing and masks and everything in our communities to make sure that it will succeed. And that's a role that we all will continue to play.
Well done. Thank you, Lane. Anybody else? Mark.
Just very brief, but it was quite an eye-opener to get all the emails over the last 3-4 days. Astounding, really. And I know that probably energy won't continue, but I think I'll echo what others have said, is it's really great to hear from the community so that it helps us go forward in our decision making. And this is going to be, not only is the lesson plan or the reopening plan a living document, but so will be all the decisions we make going forward. And so we really do need to hear from the community and from the boots on the ground what's happening out there so that we can move forward and make this as good a plan as possible. So thank you all for getting in contact with us.
Thank you. Well said, Mark. Anybody else? John, anything you want to conclude with?
Like all the board members, I too have been reading the emails as they've been coming in. So I want to thank the public for their attention, their comments, their support, their questions, their concerns. You know, I like Tom's comment that we're here, we're all real people. All of us administrators at one time or another have been teachers. I was an elementary teacher for 14 years, so I know what it's like. And this, I have to say, this has been one of the toughest things, the toughest thing I have ever dealt with personally. And I know it's been extremely tough on administrators and teachers as well. I thank them for their support, and I thank the board for their careful attention and for your support and continued support in the future. Because, as I said before, our plans here are a living document, and we will be making changes and adjustments always in the best interest of students and student safety. So thank you.
Thank you. Thank you. Yeah, I just want to thank the public participation. It has been astounding and wonderful. The work that staff has put in this summer is just incredible. Amy said the Energizer Bunny idea. I mean, my God, I don't, you know, no one's had vacations. No one's going to have a vacation. Sort of working your buns off. So just thank you so much for all your hard work, and for board members to hang in there 2 nights and have this great conversation together. It's just great. So just as we conclude our discussions of the stay safe, stay open idea and plan, the superintendent will call the roll on this important vote.
Lauren Andrews.
Yes.
Tom Pico.
Yes.
Susan Thomas.
Yes.
Gerald Winan.
Yes.
Chelsea Everett.
Yes.
Mark Lewis.
Yes.
Doug Curtis Jr.
Yes.
Lane Sturdivant.
Yes.
Amy Williams Spears.
Yes.
Carol Backhoffner.
Yes.
It's unanimous.
Great job, everybody. And Amy, thank you for making a motion to adjourn. Thank you, Doug, for seconding, and you all have a great evening. Great work. Talk to you later.
That's it.
Bye.